let's talk about supportive apparel. We get a lot of questions about corsets, belly binders, splints. Do these really help with recovery of core strength, of diastasis recti, of function postnatally, or do they get in the way of it? And the answer is this is a powerful tool that can help, but it can also hinder your recovery. And so it helps to think about the purpose. Why would we wear supportive apparel? The main reason, especially if diastasis recti is a concern, is that you want to help approximate the muscles, drawing your muscles towards the midline so that when you fire the muscles doing our exercises, you get more bang for your buck, they're more effective, and you can heal faster. A garment also can help protect that overstretched connective tissue in the linea alba and prevent it from being stressed throughout the day and help you heal faster in that way as well. But there are a few precautions. So a couple things to keep in mind. First of all, if you try putting on a corset or a waist trainer and you feel downward pressure on your pelvic floor, that indicates that you're not quite ready to safely wear a supportive garment. So you wanna make sure that you feel like it helps draw your muscles towards the center, lifts everything up, and is not ever exerting downward pressure on your bladder, your pelvic floor, your organs. If it is, then I would set that garment aside and wait for a few weeks. Just focus on strengthening your deep core with our core compressions. And then once you've had those few weeks to really reinforce your core strength, then try again and see if the binder feels better. Another precaution is that you don't want the corset to feel like it's something you're relying on to do the work your muscles really should be doing. So it can be great if you wear a corset and it reminds you throughout the day to have good posture, to use your core muscles when you're lifting or pushing open a door. So if it kind of reminds you of good body mechanics, great. But if you find that you're relying on it and you're kind of getting a little bit lazy and not using your core how you should, not thinking about your posture, just letting the garment try to do that for you, then it's probably gonna interfere with your healing process. So those are my two main precautions. One note about when to wear a corset. The most important time is if you are wearing a front-loading baby carrier. So a lot of us do that, especially if we have multiple little ones, just to deal with daily life. I personally love baby wearing, but if you have the baby in a front-loading carrier that's vertically right along your midline, then that baby's weight is pressing right onto the linea alba and it's further separating the muscles. So to protect those muscles and to protect that healing process, you can wear a corset underneath to really mitigate the strain. So that's the single most important time to wear a supportive garment if you have a newborn at home. You want to always ease into it, starting with like 1 hour a day, 2 hours a day, etc. You don't want to go straight from like 0 to wearing it all day long. Some of my clients prefer to wear corsets at night when they go to bed, because that way they just kind of put it on, go straight to bed. I guess a silver lining in having a baby is that you're probably not getting 8 hours straight of sleep. So the first time you're woken up that night, I would take it off. And then the second night, maybe wait until the second wake up. So again, you want to let your body kind of gradually get used to that compression garment rather than going straight to like all night or all day.